Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of insulin. Insulin is a polypeptide hormone used to treat type 1 diabetes and also in the late stages of type 2 diabetes mellitus. Insulin is synthesized as proinsulin that undergoes proteolytic cleavage to form insulin and peptide C, both of which are secreted by the beta cells of the pancreas. Beta cells of the pancreas are present in the islets of Langerhans, that is the endocrine part of the pancreas. Measurement of peptide C provides a better index of insulin level. Therapeutic human insulin is produced by recombinant DNA technology using a special strain of E. coli or yeast. Previously, insulin was produced from pork or also from beef. Insulin is administered by subcutaneous injection, but it can be used intravenously in hyperglycemic emergency and also in pregnancy. Regular insulin injected intravenously. Continuous subcutaneous infusion has become popular. So during pregnancy, you can use also subcutaneous or may be used intravenous. Standard treatment of patient with diabetes mellitus involves the injection of insulin twice daily with the aim of blood glucose level. That means fasting blood glucose level 225 to 275 milligram per 100 ml and hemoglobin A1C of 8% to 9% of total hemoglobin. Hemoglobin A1C gives the index of glycemic control for last 120 days. Intensive treatment requires 3 to 4 times insulin administration with a mean blood glucose level of around 150 milligram per 100 ml with an hemoglobin A1C of about 7%. Normal fasting blood glucose is about 110 milligram per 100 ml with the hemoglobin A1C is 6% of hemoglobin, of total hemoglobin. Intensive therapy results in threefold increase in the frequency of hypoglycemia. Intensive therapy decreases the incidence of long-term complications such as diabetic retinopathy that may lead to blindness and diabetic nephropathy that may lead to chronic kidney disease, renal failure, and death. Insulin is a must for type 1 diabetes. Type 1 diabetes cannot be controlled by diet, exercise, or by oral hypoglycemic agents. So for type 1 diabetes, insulin is a must from the very beginning. For type 2 diabetes, diet plus exercise, hypoglycemic drug, insulin with increasing severity of disease through 0 to 15 years on average. It will be severe, so person will be dependent on insulin. It varies from person to person, how he regulate his diet, how much he exercise depends on them. Someone, it may not go after 15 years of diagnosis, severity. They may go up to 20 years. It varies from person to person. Okay. Okay, here is the classification of insulin. We have rapid onset or ultra short acting insulin, regular insulin, insulin lispro, insulin aspart, insulin glycine. Peak level of insulin seen 30 to 90 minutes after injection. Regular injection reaches peak by 50 to 120 minutes. Regular insulin is a short-acting soluble crystalline zinc insulin. It is safe in pregnancy. Regular and lispro insulin can be administered subcutaneously or intravenously. So both regular as well as lispro insulin can be used subcutaneously or intravenously. Intermediate acting insulin, lent insulin, isofen, NPH, insulin suspension. Okay, peak by 5 hours, duration of about 18 hours. Always used by subcutaneous injection. Prolonged acting insulin, ultra-lent insulin, insulin glargine, insulin getimer, referred to as extended zinc suspension, may go beyond or close to 24 hours. Slow onset but long-lasting hypoglycemic effect. Insulin combination, 70% NPH insulin plus 30% regular insulin, or 50% of each of these, or 75% NPL insulin and 25% lispro insulin. Okay, so we may go this way, lispro insulin. So NPL means neutral protamine lispro, regular lispro for daytime like breakfast, lunch, or supper. For maintenance of night, we need the NPH, NPL, lenti for the night. Okay. So this is a chart taken from Kerjang Pharmacology. So this indicates the onset, the peak, and the duration of action. Like insulin lispro, its peak is around 1 hour. It may continue up to 5 hours. Regular insulin again peak by around 3 hours. Okay, so let me try here again. Insulin lispro, the peak is begin at after around 1 hour, and it continued for action up to 5 hours. Like NPA's peak goes to around 3 hours, and it continued for about 16 hours. These are long-acting lenti insulin detrimer is going up to 23-24 hours duration, and it has no peak. Like that, the insulin glargine, no peak, it is continued for many hours. So insulin lispro onset is very quick, maybe within 1 hour. Regular around 3 hour peak. Intermediate action, that is around 4 hours till go to the peak. Okay, duration is like that. Okay, we got that. Now adverse effects of insulin. What are the adverse effects? Adverse effects represents the symptoms of hypoglycemia. How about those symptoms? Like tachycardia, confusion, diaphoresis, vertigo, weakness. Even it may lead to hypoglycemic shock. We may have lipodystrophy. Lipodystrophy is a local atrophy or hypertrophy of subcutaneous fatty tissue at the site of injection. So it is better to inject on different places, not on the same place, to avoid lipodystrophy. There may be chance of hypersensitivity reaction, then it may be allergic. So idea is that due to the protein contaminant along with the insulin. Okay. Hypoglycemia due to the action of the insulin. Hypokalemia, again, it is an adverse effect of insulin. So we got the symptoms. of the insulin use and the adverse effects. Okay, so insulin causes hypoglycemia. It may be severe, that may lead to hypoglycemic shock. Okay, and that's all about the pharmacology of the insulin. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.